More than 250 residents in Spartanburg County, South Carolina, are in quarantine due to a major measles outbreak. The state's Department of Health confirming 111 active cases. This marks the second U.S. measles surge this year, with 1,912 cases so far, a more than 14,000% increase from 2020. Fox News medical contributor Dr. Nicole Saphier joins us now with the latest. Good morning to you, Dr. Saphier.
Good morning, Ainsley.
Good morning. What is causing all of this? This is where I was born, in Spartanburg. This is very concerning.
Absolutely. Lots of evidence of community spread of measles, not just on the East Coast, but throughout the country as well. We're seeing rising numbers. As you have mentioned, hundreds of kids and people who have been infected, even more in quarantine. And to be honest, this is somewhat expected as we see declining vaccination rates. The United States is in jeopardy of losing the elimination status of measles for the first time since 2000, once it was declared. Canada just lost their elimination status this year, and they have vaccination rates of about 82%, much lower than the United States. But the reality is, Ainsley, we have seen our MMR vaccine rates go from 95 to 92% in just the last 5 to 6 years. When I said during COVID that the Biden administration's CDC was the biggest single risk factor for vaccine hesitancy in the United States, I was not mincing words. And because of the mishandling of COVID, we started to see even a bigger decline in vaccination rates. Unfortunately, the way things are going right now with the CDC and the current vaccination advisory committees, we're seeing even more mistrust and confusion. And so I expect that we're going to see further declines in vaccination rates, and we're going to see more measles cases. Lots of cases in Canada, lots of cases in measles, and we're in the middle. Usually we are protected by high vaccination rates, but as they decline, we will see more community transmission here in the United States.
Okay, Dr. Saphier, the Senate failed to advance measures for the health care plan. They expire on the end of the year, December 31st, and we're going to see prices go up on insurance if this is not fixed. What's your reaction to that, and what do you think is the best plan?
So the Senate rejected both the Democratic and the Republican plans that were put forth for the health care. And to be honest, that was the right move, because whether you're looking at the Democratic Medicare for All or the skinny piecemeal GOP plan that was presented, neither are going to work unless you focus on fixing the fundamental damage caused by the ACA. What the Affordable Care Act did was they took away power from the physicians and the patients. They gave it to the hospitals and the insurers. This led to consolidation, increased prices, decreased quality, and a third last year of Americans either delayed or didn't get medical care because of cost. That is not affordability or access. That is failure. And you don't fix healthcare by doubling down on what failed. The only way forward is true, meaningful reform. And what that will mean is you have to expand some of those subsidies, even if it is for the short term, just to give some short-term fix for the people. You want to have aggressive fraud enforcement, expand the HSA, allow physicians back to own hospitals to bring that market pricing, because they took away the free market in healthcare, increase price transparency, remove a lot of the prior authorizations, and make sure that hospitals have out-of-network coverage. In my opinion, Senator Marshall's plan is the most comprehensive healthcare reform plan we have. Not only does it have short-term relief for the American people, but is the only one that, in my opinion, has the teeth to really have long-term success. I hope Cassidy and Marshall work together. Very smart politicians, they understand, they get it. We need to bring free market back to healthcare to do what's right for the American people. We do not want them to suffer from these high rates that are about to set. So we have to make sure that we give them short-term relief, but we also need that long-term plan in place to really peel back all the damage that the Affordable Care Act has caused.
Dr. Saphier, great to see you. Thank you so much for coming on.
Thanks for having me, Ainsley.
You're welcome. Have a good weekend.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.